1 minute. Jivita, you can go live now.
Thank you. A very good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patient to access the right treatment on right time. We are honored to welcome you all to the live session on Know About the Stomach Cancer, a crucial opportunity for all of us to dwell into the complexity of this condition. Today, we are privileged to have with us a distinguished expert, Dr. Krishnamani, in the field of oncology. Dr. Krishnamani has more than 10 years of experience in treating different types of cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. Doctor, would you like to add some opening statement for this session on stomach cancer?
Hello, everyone, and thank you so much. Welcome to Cancer Reach, as always. Cancer Reach is an initiative, as you know, to spread awareness about cancer and to spread knowledge about cancer, be it in lay people, be it in patients, families, and everybody else. Gastric cancer or stomach cancer, this is November, and we are in the Stomach Cancer Awareness Month. So most of our live sessions are usually centered around those cancers which fall in those particular months. So that being the case, today we shall learn a bit and share our knowledge on stomach cancer or gastric cancer.
Thank you, doctor. As doctor has already addressed, stomach cancer is also known as gastric cancer. So with all our collective responsibility to stay informed from the prime expert like Dr. Krishnamani about the latest development in order to provide the best possibilities care. So without any further delay, I would like to, and let's begin with the session. And also we encourage active participation from our audience. So kindly ask your question in the below chat box available on your screen. So doctor, let's begin the live session on stomach cancer. So doctor, what is stomach cancer? Doctor, you are on mute, I guess.
So stomach cancer is also known as gastric cancer, and it's a very dreaded cancer, if you may call it. It's one of the leading causes of cancer death in the world, and some estimates put it at the fourth most common cause of cancer death in the world. It's commonly seen too in India, that too with our population. We see a lot of stomach cancers in the clinic. And unfortunately, most of these cancers present in an extremely advanced stage. So from a layman perspective, we are dealing with a common cancer. We are dealing with a dreaded cancer. We are dealing with a cancer which unfortunately presents in the advanced stage, even in the most developed countries of the world, and more so in a country like ours. And all efforts are being put by clinicians, by researchers, by oncologists to somehow beat this cancer. I would not say we are unsuccessful, but then we have a long way to go.
That was quite informative, doctor. Doctor, what are the causes of stomach cancer?
So when you talk about any cancer, the first thing which we should learn or we should understand is how this cancer is caused or what are the common causes. And we often say that cancer is curable if detected early, and some cancers are preventable. So do we have any reversible factors for stomach cancer, or do we have any preventable factors for stomach cancer? So to know that, you need to know what are the causes of stomach cancer. So broadly, there are certain factors. Age is an important factor. Stomach cancer is usually seen in men or women above 50 years. Not that you don't see it in younger people. We do see, but generally above 50 years. Stomach cancer has commonly been clustered in a few geographical areas. Now, for example, Japan has one of the highest incidence of gastric cancer or stomach cancer. So the reason is genetic, environmental, food, etc. And the funny part is, when you move away from Japan, suppose a native Japanese guy goes to, say, North America, which has lesser incidence of stomach cancer, he being a native Japanese, being born and brought up in Japan, has the same high risk of stomach cancer, even though he has migrated to another country which has a different environment, different lifestyle, different food eating habits, etc. But if he continues to stay in North America, his successive generations, his third generation or fourth generation, the risk of getting stomach cancer is equal to a North American guy, which is much lower than a Japanese guy. So, what we must understand is because of change or migration, the risk is coming down, not in that generation, but in the subsequent generations. So, there is an environmental factor due to migration, and there may be certain other factors like diet, etc., which is reducing this risk, and vice versa. So, again, coming back to our causes, one is age, one is your location. Countries like Japan have a very high clustering of stomach cancers. Smoking and alcohol have been, cigarette smoking and alcohol have been implicated in stomach cancer. So these are preventable. So the aim of Cancer Reach is always that we want to have a control on certain things which can prevent cancer or delay cancer. So obviously stop smoking, do not take alcohol, probably reduces the risk. Helicobacter pylori is a bacteria which is present in the gut that is implicated in stomach cancer. So people who have H. pylori or Helicobacter pylori infection, if you treat it with antibiotics, the chances that when you don't have infection, the chance of you getting cancer are low. So this is another reversible factor. Less than 3% or 4% stomach cancers are seen in families. They are due to certain gene mutations, but it is not that these mutations are like your BRCA mutations in breast and ovarian cancer where we start screening everybody. So it is not for routine screening. But when you see stomach cancer in young people clustered in a family, most likely it is due to genetic reasons, and the gene which is generally involved is called a cadherin gene, cadherin gene, CDH it is called, but it is not a widely available or a test which you should do on a routine basis. And then, as we discussed, the environmental factors, food which is rich, less in vegetables or fruits, has been implicated that there could be a risk in stomach cancer in those people who consume less fruits or vegetables. So overall, it's a mix of multiple genetic, environmental, and then habits, etc., which few are reversible. But in most patients who walk into your clinic, you don't have a particular cause. They may not smoke, they don't have alcohol, they don't have a family history, they are young, but unfortunately they develop stomach cancer. And last thing, there is something called syndrome which we use in clinical practice. Syndrome means a clustering of features. So there are a few syndromes in which patients have a tendency to have stomach cancers. For example, Lynch syndrome or Peutz-Jeghers syndrome we call. So if they have these syndromes, the chances of them developing stomach cancer is higher.
Was quite informative. Doctor, when you were addressing the Japanese people having high risk of stomach cancer, I was thinking that they eat each and everything and they eat everything and all. Generally, we see in many of the videos and news also, they eat everything. Nothing is left which they don't eat.
I don't think we are also far behind. I think we also eat anything and everything. Like my teacher used to say, we eat anything and everything which swims, which flies, and which crawls and walks.
Absolutely, doctor. That's very true. So, doctor, there is one question from the audience. Ramesh, does eating spicy food causes stomach cancer?
No, but it can cause gastritis for sure. So, uh, so they see diet and cancer. It's a very, very what do you say? Never have a very clear association. So some studies may say this can cause, some studies may say this does not cause. But for sure, yes, we advise all our patients not to have a very spicy diet, especially people who come from Andhra and Telangana, the southern part of the country. We eat a lot of spice. And if you compare that to a European or an American, if he comes and has our food, then he'll just be gulping a lot of water and not even a few morsels of the food we take. But jokes apart, spice, yes, can cause gastritis and belching and some symptoms which can mimic any kind of a GI or gastrointestinal issue. So there is no direct link per se between spicy food and stomach cancer.
Okay. Sir, the same question from the same person. He is asking that does drinking hot tea or hot water causes stomach cancer?
Not hot water, but hot tea can cause in certain areas of the world, especially in certain parts of China. It has been proven that they take a particular kind of tea in a particular way. In so because the climate there, I believe, is very cold, and when they take that, they have a high risk of developing strictures in the esophagus and esophageal cancers, etc. So that's why the elders always tell you that don't gulp your food too hot. So that's one of the reasons. So you should always eat slowly. Uh, Eat when it is warm, not too hot, not too cold, never frozen, like how other people do. That's the other extreme. And chew your food. Do not swallow your food. Always chew your food, relish your food. That may not be linked to what we're discussing now, but that's the way we should actually eat.
That was quite informative. I remember one rule, 30 times, 32 times chewing your food will make you healthy.
Okay.
So, doctor, what are the symptoms of stomach cancer?
See, stomach cancer, as I told you, by the time one develops symptoms, the disease is advanced. And usually patients are symptomatic. So, what are the symptoms? The symptoms are pretty vague. Somebody can come with nausea, they can come with belching, they can come with vomiting, they can come with weight loss, they can come with pain in the tummy, they can come with burning pain in the chest, retrosternal chest pain, they can have loss of appetite, they lose a lot of weight. If it is advanced, they develop fluid in the tummy, which is called ascites. They may develop edema or swelling in the limbs because of low protein. If it's even more advanced, they can develop jaundice if it spreads to the liver. So, and they can develop either a black colored stool or fresh bleeding in the stool too sometimes. More commonly, black colored stool. So these are all the symptoms of stomach cancer, but it doesn't mean that these are all equivalent to stomach cancer. Belching, nausea, vomiting, you can see in a variety of gastrointestinal issues like acidity or gastritis or any kind of normal things also. So it doesn't mean that all this is equal to cancer, but stomach cancer presents its symptoms which do not differ from other common conditions. But by the time the patient presents its symptoms, it's usually pretty advanced.
Almost like you can say it's like a fourth stage, doctor.
Yes, usually stage 3 or stage 4. The guys who are picked up early are those who sometimes get incidentally picked up. That is, they go for something else and then they get picked up, or they have some vague symptoms and they just get tested, and you pick up a very, very early lesion in the stomach on endoscopy or something like that. But per se, that small thing would not cause any symptoms.
So there is one query from the like by name called Manu World. Can food cancer, which kind of a food causes stomach cancer?
Any diet which has less amount of fruits or vegetables has been implicated, or less amount of antioxidants has been implicated in causing stomach cancer. See, all these associations, as we just discussed, are not concrete. But yes, as we always speak on Cancer Reach, a balanced diet is what we all should follow. And obviously, abstaining from certain things like smoking and alcohol, which would reduce the risks of developing any cancer, and more so stomach cancer.
Thank you, doctor. Doctor, how to diagnose stomach cancer?
So once somebody presents with the symptoms and you're worried that this guy or lady has stomach cancer, then you have to diagnose. See, as we always discuss, cancer has to be diagnosed only on a tissue, which is called a biopsy. So for stomach cancer, we usually do an endoscopy. It's like you put a small tube inside the mouth and into the tummy, which has a small camera at the end, which visualizes the entire stomach. And if there is any suspicious area like an ulcer or it is bleeding, you take a small piece from that and you come out. So that endoscopy does two things. You're going and seeing what is there inside, and you're also taking a part of it and coming out for diagnosis. That is sent to the lab, and on histopathology or on pathology, the doctor tells you, the pathologist tells you, you have stomach cancer or not. Now that in medical terms can be either adenocarcinoma or squamous carcinoma. These are the two common types. And then now you have to find out what is the stage of the disease, for which you will do a CT scan, or you will do sometimes something called an endoscopic ultrasound. So that will tell you whether the disease is there, or it is spread to the nearby lymph nodes, or it has spread to other organs. So stomach cancer starts in the stomach, it goes to the nearby lymph nodes, and then it spreads to commonly to the liver, lung, and to the omentum in the abdominal area, where if it progresses, it may form fluid in the abdomen. So these are the common areas of spread. So first you diagnose with a biopsy, you do an endoscopy and a biopsy. If you have lumps anywhere else, you can do a biopsy from the supraclavicular node or from the neck node or anywhere, number one. Number two, you do scan like a CT or a PET to know where all the disease has spread. If you have water in the tummy or fluid in the tummy, you can even take that fluid and send for analysis to the lab. If the fluid is involved with cancer cells, it is stage 4. So these will give you a diagnosis of cancer. We'll tell you whether it's an ulcer which is bleeding, etc. We'll also tell you the stage. And there are stomach cancer is also classified as being a diffuse stomach cancer or an intestinal variant, we call. So that also will be known with these tests. And broadly, we call it either adenocarcinoma or squamous carcinoma, but in layman terms, it is stomach cancer.
Sir, there is one query from the audience, Shiv Sharman. Sir, there is a continuous pain in my stomach. Is it can be a cancer?
So, see, the minute we spoke about stomach cancer and how, what do you say, arbitrary or whatever the symptoms can be. They're not, it is not that these symptoms are equal to stomach cancer. You can have a pain in your tummy for thousands of reasons. You could have a gallstone, you could have a kidney stone, you can have nothing, you can have acidity, you can have muscle spasm. So the aim of this platform is not to scare you that any pain, any weight loss, even half a kg, go and you have stomach cancer. No. So please don't get scared. That's not the aim of this platform. The aim of this platform is for us to be aware. And if this pain is persisting, if this pain is having other associated symptoms, please go and show your doctor. And if you have certain aggravating factors like you drink a lot of alcohol, you smoke, or you take a lot of spicy food, or if you are a known case of acidity or gastritis and not on medications, try to set those things right. Cancer is not the first thing should be on the mind of everybody. You have those things are more common than cancer. Gastritis or an acidity is more common than cancer. So rule those out first and then go for malignancy, and don't do it yourself. Go and show to your doctor.
That's quite informative. Nowadays, everybody, anything is like, okay, I can be, they think of severity, then they come to the minority. Like they think very
Correct.
severe disease or like that.
Correct.
Doctor, what are the stages of stomach cancer?
So very simply, you can call it stage 1, 2, 3, 4. So most cases are stage 3 and 4. 3 means it usually spreads to lymph nodes. 4 means it has spread to major organs with water in the tummy or liver, lung involvement, etc. Stage 1 and 2 are very early, and they can usually be detected only on surgery. When you do a surgery and send the tissue, then you come to know that it is stage 1 or 2.
Doctor, what are the different types of treatments available in stomach cancer?
So as we always discuss on Cancer Reach, if you're talking about stage 1, 2, 3, you're talking about cure. So you're looking at curative treatment, where surgery is an integral part of treatment. Surgery is a very important part of your treatment. But usually what happens is we give chemo first. If you have stage 2 or 3, we usually give chemo first, shrink the disease, do surgery, and then give chemo. Some places they do give radiation also. So when you're talking about the early stages or even up till stage 3, you're talking about potentially curing the person, and you have to put all your effort to cure him. Chemo will be even initially based on the patient, his health condition, and your doctor's preferences. Surgery should be a part, and radiation would be decided by a doctor. When it comes to stage 4, you're not talking about cure, you're talking about quality of life, you're talking about prolonging the life, you're talking about reducing the disease. So there you're talking about chemotherapy for all these reasons, or targeted therapy or immunotherapy. Surgery is generally not done in stage 4, and radiation is usually not done in stage 4 unless there is a lot of bleeding. So you use all these 3 modalities, surgery, chemo, radiation, etc. But it depends on what stage, whether you're curing him, you're trying for cure or for palliation, for improving symptom control, and in what order are you using these treatments.
Doctor, what are the different chemo treatments available in stomach cancer?
So as a medical oncologist, the bulk of my work is with chemotherapy. In stomach cancer, since we see most patients beyond stage 2, if you're talking about curative treatment, like stage 2 and stage 3 patients, we give chemotherapy first. We shrink the disease and then take them up for surgery. The results are better. There are different chemotherapy medicines, different chemotherapy regimens. Some are given weekly, some are given every 2 weeks, some are given once every 3 weeks. The 2 weekly regimen, there is a regimen called FLOT, F-L-O-T. It is a bit troublesome in the form of side effects, but that has the best results. So when your doctor advises you to take FLOT, he will give you 4 cycles before surgery and 4 cycles after surgery. It is once every 15 days. And the medicine can damage your veins. So your doctor will put something called a PICC line. So that is an IV line in your hand. Or he'll put a small chemo port, which is a button-like thing under the skin, so that your veins are not damaged and a chemo can be given through this. So that's the first part. So that is a delivery system for your chemotherapy. It has nothing to do with your cancer or treatment. The chemo port can stay for 4 to 5 years. The PICC line can stay for 6 months to 1 year, depending on the type which you choose. And through this, you give your chemo. You give 4 cycles before and 4 cycles after surgery, once every 2 weeks. And these give you the best results for patients with non-metastatic or stage 2, stage 3 gastric cancers. In somebody who's unfit for this medicines which are having a lot of side effects, you would try to choose simpler medicine because most patients are old, they are frail, so they may not qualify for treatment also. That is called best supportive care. They may have stage 3 disease, but you may say, I cannot give chemo because this guy will not tolerate. Or you may give a simpler chemo, which is a weekly chemotherapy, that the doctor will decide looking at the patient and the fitness and all that. But if somebody is fit, FLOT is the treatment of choice for 8 cycles, as we discussed.
Doctor, there is a query from the audience by name called Piyush Mas. Can stress cause gastric cancer?
No, I don't think so. Stress can cause anything, by nature, but no, it's a far-fetched thing.
Nowadays, doctor, stress became a part of everybody's life. It's good if it is not everybody's life, but yes, stress has become a part of life. Doctor, there is one more question from Manju. Is stomach cancer genetic?
We discussed that in 2 to 3% of patients, you may find people clustered in a family with stomach cancer. They are seen in younger people. They are seen with syndromic association. Certain types of cancer are seen with colon cancer or with CNS tumors or lobular carcinoma breast, and they usually have a genetic mutation called E-cadherin or CDH1.
Doctor, there is one more query from by name called Mudassar. Indigestion for long period of times, is it like I have stomach cancer?
No, again, any of these are vague. Think of common things first.
And also, the continuation, can constipation lead to cancer?
No.
So, doctor, what is the immunotherapy in stomach cancer?
So, in the past episodes of Cancer Reach also, we have discussed in medical oncology, we are moving away from chemotherapy slowly because chemotherapy has its own set of side effects and cannot be given for a continuous period. So, we are looking at treatments which can be given for a longer period of time, which do not have the side effects of chemotherapy. One of such treatments is immunotherapy, which enhances your immunity to kill the cancer. And we use it commonly in lung cancer, in kidney cancer, in melanoma. It is also used in gastric cancer, in the metastatic setting in stage 4 cancers, where you add it to chemotherapy, and after the chemo is stopped, if there is a response, the immunotherapy is continued. The good thing is these immunotherapies don't have the side effects of chemotherapy like hair loss, loss of appetite, nausea, vomiting, fall in WBC counts, etc. But their side effects are different. You can have thyroid problems, some liver function abnormalities, some lung issues in less than 5 or 7% patients. So it is not a game changer, I would say, like in renal cancer or in lung cancer or in skin cancer. But yes, in a certain set of patients of stomach cancer, we do a test called a PDL1 on the tumor tissue. If the score is high, adding immunotherapy to chemo gives you a little bit benefit, and you can avoid chemotherapy after some time and the side effects of chemotherapy.
Doctor, what is the prognosis of stomach cancer? So
if you remember the first few minutes we spent that this is a dreaded disease and it's an advanced presence in an advanced stage, that is because the prognosis of this disease is pretty bad. If you look at stage 1 or 2 stomach cancers, your prognosis is maybe the 5-year survival is between 60 to 80%. If you come to stage 3, it is like 30-40%. If it's stage 4, it is less than 5% or close to zero. So if somebody is diagnosed in stage 4, his average survival is close to 6 months to 1 year, or maybe 9 months to 1.5 years. It is not that somebody on treatment doing well will die at 15 months or 18 months just because we have told it. Every person is different. But stomach cancers are bad, survivals are limited. In advanced stage, this is what we should take home. That's why immunotherapies. That is why a medicine called trastuzumab, which we use in breast cancer, in HER2 positive breast cancer, you do HER2 testing in stomach cancer, and if you're positive, you are given trastuzumab also. You're trying all these kinds of things to improve the survival in advanced cancer, and you're trying everything to prevent stomach cancer, which are the reversible factors like H. pylori treatment or smoking, alcohol abstaining, and all that. And in the early stages, you're trying to give FLOT prior to surgery and after surgery to improve the results and improve survival so that the recurrence is much lower. So all these kind of treatment evolution in early, middle, and advanced stage with chemo, targeted immunotherapy, types of surgery, advancements in surgery, etc., has been done only to improve the survival of this bad disease.
That was quite informative, doctor. Doctor, there is one query by name called Hamid. I have a small lump in stomach. Is it a cancer? Do I have to consult a doctor?
I believe you may have a lump on your abdomen on the skin. It could be a benign lump like a lipoma or a fat lump. Just have a look at it. If it is not increasing in size, if it is being there for a very long period of time, you need not worry. But you can anyway consult a doctor once to rule out.
Doctor, there is one query from Venkat. A person with stomach cancer cannot live for longer life.
We discussed that advanced stomach cancer survivals are unfortunately between few months to a year and a half or so.
So, doctor, here we bring this live session on stomach cancer to almost an end, doctor. So, I wanted to express my sincere gratitude to all of you for your active participation. Dr. Krishnamani has provided us a lot many informative insights on stomach cancer. Doctor, would you like to add some closing remark to this informative stomach cancer session?
Yeah, so first of all, very grateful to all of you that we have been doing this as part of an awareness program for people. And regarding stomach cancer, we are dealing with a difficult disease. We don't have effective screening. We don't have major risk factors apart from few. So, and unfortunately, it presents in an advanced stage. But I hope that this knowledge will be useful for people, and it is not that you get scared and start running to the doctor at every small indigestion, but to be aware that there is a cancer like this, and this is what the cancer is all about. Thank you so much.
Thank you. Even doctor, just to add, I was always thinking that breast cancer is more severe, brain tumor is more severe. After listening to this session, even stomach cancer should also be considered to be as severe, because everybody are talking more about breast, brain, and something which are very well known to everybody. But stomach cancer is something which is not known, but it can also be, the awareness is very much required for stomach cancer. Thank you, doctor. Thank you very much for this insightful. Doctor, yes, you were speaking.
No, thank you so much. Thank you.
Thank you, doctor. Thank you, everyone, for joining us today. Wishing you all strength, hope, and good health.